Well, there's a lot of controversy in ACL repair. I think most surgeons are still using what we call a single bundle, but the ACL anatomy has two distinct bundles that are associated with an anterior medial and a posterior lateral that kind of go like that through diagonally across the middle of the knee. So some surgeons will reconstruct it with two separate bundles, but a comparison of studies to repairing it through just one tunnel each in the tibia and the femur bone haven't really shown any superior difference. So that's really not that difficult a procedure to do. You have to become very familiar with what we call the isometric point, or the ideal point to put the ligament inside the knee. For younger patients, I prefer to use their own tissue, and I think the strongest graft is a patellar tendon graft, taking the center part of your tendon between the kneecap and the tibia bone. Other surgeons will use hamstring tendons, and those patients have a very high success rate. It's a relatively quick surgery. The patients go home the same day and are able to get up and start walking on it right away. There's newer techniques to help us get the position of the holes in a better position. I was able to learn some new techniques almost 15 years ago where we drill through actually one of the openings into the knee joint, or medial portal, instead of having to drill through the tibia. So that's been one advancement to make the repair more consistent. But I think my patients, I've been able to get back to sports and do just about anything they want once it heals, but they got to give it enough time to heal.